Much excitement here in studio with Sundowns. The big winners here having their photograph taken. So well done, Sundowns. Okay, it's almost 10 minutes before 8 here on the program. A group of Black and Indian private medical practitioners allege that they are being unfairly treated by medical aid schemes based on the colour of their skin and ethnicity. According to the group, they are exploited and harassed by medical aid schemes. They say one of their biggest struggles is payment from medical aid schemes. The group also says that there is a national list with names of Black and Indian practitioners from across the country that is circulating among medical aid schemes, and that the names on this list are often targeted. All right, let's talk more about this. We've got a clinical social worker in studio with us. It's Gatsheni and Dr. Donald Gumede, who's the chairperson of the National Healthcare Professionals Association. Now, they are part of a group of grieved healthcare practitioners. Morning Live has invited the Council for Medical Schemes, but they unfortunately declined the interview as they say they do not have enough time. All right. Good morning. Good to have you both in studio with us.
Good morning.
I want to get into this very quickly because we've got not too much time, unfortunately. So this group of practitioners that you are part of, I'll begin with you, Dr. Gumede.
All right.
How did you form it? When did you realize that you're being treated this way?
Actually, it started a long time back, but in the 2000s, it became worse. And then 3 years ago, then we realized that, no, we can't just lie down and we be exploited financially by these big medical aids. We tried to engage them. We went to their offices and tried to tell them that what you're doing, we believe it's illegal. Because the act that they use to extort money from the healthcare workers, Act 59, it's not being applied properly. And we had said also, if you believe that a clinician or a practitioner had done something wrong, we've got law institutions where you can report them. But instead, they call you to their offices and put you under duress and say you must sign an acknowledgement of debt that you owe them. Where they become a police officer, they become the prosecutor, they become the judge and the prison wardeners. When you move out of that place, they would have made you to sign, if you don't have facts, sign huge amounts. I'm talking about huge amounts, not small amounts here, up to R1 million. And I mean, if it's fraud, they should report it to the law agencies.
Let's talk to your experience, Noma. Okay, there's a lot of accusations happening right now, but from your side, talk to us your version of events.
According to me, from 2017, actually from 2014, I started to experience the audits going on, and audits happen to be coming almost every year. And this is the experience of most of the health practitioners, especially the Black and Indian ones.
Okay,
true.
So this is what is happening. You hear, because we work in same spaces with all races, then you hear your colleagues around you talking about audits. You hear people frustrated, people depressed. I'm talking of doctors, psychiatrists, social workers, psychologists, physiotherapists.
Have you personally experienced this?
Yes, I did.
Even myself.
You've also experienced this?
Yeah.
100%.
What kind of, I mean, you talk to audits, you talk to, I mean, I was reading articles where you personally were speaking about hidden cameras in practices.
Correct.
Where they send in undercover patients.
Correct.
Are these, I mean, how do you prove this? How do you know that this is in fact happening?
Because they tell you. They tell you. When you get there, they've got this forensic unit and it's run by ex-cops. And I'm sorry to say this, but it's true. It's like we have another flag plus, which actually it's want to destroy the careers of Black practitioners. Because in truth, the list we have, it's long. And it's just for a small medical aid called GEMS, the list that we have. We leave it with you guys. You can follow it up. It's not a lie. It's a truth. It's happening. As we are talking here, there are people who are queuing in Sandton and Roodepoort who are called by these medical aid for the same practices that we're talking about. And people commit suicide, practitioners. There are lots of them. We buried them. I'm the chairperson. I've been to those funerals.
And they're committing suicide
because of the financial constraints. Because what they do is
because the medical aids are refusing to pay them.
Yes, they will say they will pay you. That's where we say as an association, who's defrauding who? They say to you, you owe us 1 million. If you pay us 1 million, we'll continue paying you. If you don't pay us, we withdraw the payments.
Yeah.
So, I mean, where is justice there? Because then, and they look at who pays you more. If Discovery pays you more, they will come and say, okay, we are paying you more. Why are we paying you more? It means you are defrauding us. Then you must pay this acknowledgement of debt.
Yeah.
Of debt, which is very bad. Many people are bankrupt, and most of the people who went to work in hospitals, in particular, the doctors or healthcare practitioners, they were forced out of the system out. And it's the same thing with pharmacists. We saw it started with pharmacists. They started with GSCAMs, the Medi-Rights and cliques, and everybody, and took that space from the black pharmacists. There are no more in the township. The pharmacists that pushed out.
Yeah. So what's being done about this? Okay, so we're talking to allegations, and these are not. This is not new.
Correct.
This has been around, and it's been something that's been quite well documented.
Good.
At the last time we sort of were looking at this, you were drafting a letter to the president
Correct.
and also to the health minister.
Correct.
So let's now get an update. Where are we at looking into this?
3-4 weeks ago, I was in the big debate with Reddy.
Yeah.
We're talking about the very same thing. The minister agreed there on that. You can go on records. There are 18 acts which are illegal, which he said he wanted to go and repeal them or amend them in parliament. The medical aids blocked him through legal means. There's a health inquiry commission report which was drafted by the retired judge Sandile Ngobo. Where is it? 4 years ago, it's still sitting. He can't act on it because they're interdicting him.
Yeah.
So they have the money. I went there with the general secretary of our association. They told us they've got 40 billion in legal muscle. We can't do anything. And then we took them to court for the same Act 59. They said, no, it's not going to see the day of light in court. We have the documents. We have the papers. And then they literally said, we'll come after you, Gumede, and we'll bankrupt you.
So this is openly happening, is what I'm hearing.
It
here.
is.
Yes,
I mean,
it
this
is.
You've
It's not
seen this.
clandestine.
You've seen this list. Is your name on there?
I've got a list.
Is your name on that list?
Fortunately, my name is not on the list, but
Yeah.
I've got most of the colleagues which I'm aware of and we work with. But the list, something that's amazing about the list is that the list is black or Indian. 22 pages of that list. This is one smallest medical aid. But when you talk of other medical aids, specifically the leader
The medical aid is GEMS. This is the medical aid you're referring to. Different medical aids.
It's different medical aids, but there's a leader who is discovering. That one is making sure that every black practitioner, every Indian practitioner is out of their system. This is how they do. You get the letters that are inviting you to say you are due for review. And you start, and they will note that what is needed. They will tell you first that your tariff codes are high, you are a risk to the medical aid scheme, you charge more than your peers, so bring the following. Bring the clinical notes, bring the diaries where you were seeing patients, bring the files of the patients. Now this is where the problem begins, because ethically so, how do I disclose the information, private information of the patient?
Yeah,
To a third
indeed,
party.
indeed.
Now, I've got three problems with that. One, why am I getting audited, especially with confidential information of the patient? Two, why are these audits, the manner in which these audits are done, why is it targeted to blacks and Indians? And I'm not saying white people are not audited. Definitely they are, but very few percentage of them, because you don't hear anything about white. In the list, you don't get even the white
One
people.
single name.
No.
There's not a single
person.
name of any
Yes.
white doctor on that list.
Yes. So now you start to question, why is it only blacks and why audits in confidentiality of the patients? Two, why are you audited without a contract? Remember, if you say you're going to audit the health practitioners, you should give us first the contract. When we sign, you should make us sign something. Give us a contract that you will be audited, and when are you audited? What is it that is audited? so that we can tell you that there is an information that we can never retrieve to you, which is a confidentiality to the patient's lives. Patients trust you with that information.
Yeah.
Most often that information is very sensitive.
So what's the next step? I mean, I apologize, but time is really against us.
Thank you.
So we know what's happening,
Yeah.
but where are we going now? I mean, you're saying your hands are tied, the courts are not getting involved, the minister
Yeah.
can't help you.
Yeah, you see, that's why the association was started. We are privately raising funds to try and take the case to Constitutional Court, because we believe that the Constitutional Court is the only remedy which can interpret that act that they're abusing properly. Number two, there's a difference between, which I didn't explain from the beginning. The people who are causing the problem are the administrators, not the medical aids in particular. Because the administrators are the people who are making profit. Medical aids are supposed to be non-profit organizations. But the people who are extorting money is the administrators, and the money doesn't go back to the patients. It stays with the administrators. So if you go around Sandton, you'll see the big tower buildings and Rodeport and everywhere where there are these administrators. The person who's suffering is the patient. By now, in May, majority of the patients, they've run out of funds. They don't have medical aids. And then they must dig from their pockets and pay for their services. So we have engaged the minister, like I said. I hope he goes back. I don't know, because he knows the case, and we were with him on Monday, talking about the very same thing that we're talking about.
Okay.
So he's well aware about it.
I'm going to pause this because we just want to, I need to give you a little bit more time on this interview. It's far too important to wrap this up, but we do need to get the news. So, Sakina, I'm going to hand it over to you to very quickly get an update on the news, and then we'll come back and wrap up this interview. But it is 8 o'clock now.